People come to this country, they aren't even true asylum seekers. They're here to take advantage of our system. And those individuals, for up to 1,000 days on average, Mr. Speaker, were receiving extended interim federal health care benefits that included dental, that included health, that included prescription drugs. Mr. Speaker, it was unfair. It was wrong. We stopped it. And now, if you are a true refugee, you are obviously going to get the benefits that are extended to other Canadians. Mr. Speaker, we didn't allow that to happen then. Canadians are behind us now. And in my rebuttal, I'm going to show you and prove to you that Canadians are behind this government in terms of the decision it has made.
This is totally against of the basic human rights. The government of Harper government, they are violating the human rights, something that we have been a country that we signed. They are violating the Convention of Protection for Refugees, because they have to provide basic services. And basic services for here in Canada is to have a health coverage. And in the meantime, as we have been helping and being the voice of the people without voice, as we have been doing in El Salvador when I was a citizen in El Salvador, we will be opening and we will put together the community once a month, a health clinic that they will receive primary care, people who doesn't have access. And we will do it together with doctors, social workers, trauma counselors, and with the community in general. And that's we are responding because this is our obligation on Canada Day as a Canadian citizen.
For the past 2 years, this basement has doubled as a doctor's office for people denied health care.
I've been turned down from a hospital before because I didn't have my haircut, and they don't accept another ID.
This man asked us not to use his name. His refugee claim is still being processed.
It's really a bad feeling that you're in a country where you know that the health care is it's very effective and it's very good, and you get denied. So it doesn't only cause you to be sick physically, it also causes you to be sick emotionally.
Diana De Silva helps run this clinic and says she sees the demand firsthand every second Saturday when her waiting room fills up.
For example, we have 3 walk-in clinics around this area, and they refuse to take refugee claimants.
The clinic was set up back in 2012 when the government first announced it was scaling back on health care access for refugees. Yesterday, a federal court ruling challenged the government's plan.
The federal court called the government's treatment of refugees cruel and unusual, and that it puts the lives of people in jeopardy. They've asked Ottawa to make changes in the next 4 months, but the government says they will appeal.
Visitors to Canada are not entitled. Failed refugee claimants, bogus refugee claimants are not entitled. And that shouldn't change in our view.
The government claims they are saving hundreds of millions of dollars with this move. Many in the medical community say there is no proof to support that.
What this bill did was it denied many refugee claimants primary care, which is preventative and inexpensive.
Dr. Jim Sugiyama is one of the many volunteers that keeps this clinic going.
We see diabetics and hypertensives, people with heart problems, lung problems, cancer, all of whom have been denied medical services since Bill C-31.
That bill, he says, also forces patients to pay for medication, including insulin and prenatal needs. As the government plans its appeal, the team here says they'll continue to provide care to whoever needs it. Tashana Reed, CBC News, Toronto.